the same two conditions. And medicines aren't going to necessarily eliminate that. Remember, we can't take the symptoms away completely. And so some level of discomfort is going to be there, maybe only when you press on the abdomen, maybe only when a toddler jumps on your belly. So we can't eliminate that with most medications and efforts. What we're trying to do is take away the more severe symptoms that are truly affecting your quality of life and affecting your work, and affecting your relationships. But some low-level discomfort most of the time is going to be there and will remind you that it's there. Even when you're driving in a car, you hit a bump, the car goes up and down, boom, your intestines feel a jerk and it's uncomfortable. We also see sometimes from our female patients that that intercourse is painful, or dyspareunia, the medical term for painful intercourse. Some women will experience IBS symptoms during intercourse from the rigorous movement during sex. This is a very serious quality of life issue that can frequently strain relationships and contribute to a downward spiral of the whole IBS picture, where someone with IBS who is untreated and or undiagnosed begins experiencing anxiety now and possibly depression. Their personal relationships are suffering, and this can only exacerbate, as you've seen, the underlying condition and worsen the already present symptoms. So many women will seek the OB/GYN doctor for an explanation. After the GYN workup and usual ultrasounds and pelvic exams are normal, many are left without an explanation, or hopefully referred to a GI specialist who is well versed in irritable bowel syndrome. So again, the sigmoid colon and the rectum are very close to the vaginal canal. And again, just like in a car, if you hit a bump, you just lie against the sink, intercourse can be painful to women with IBS at times. And again, treatment with medicine should reduce it enough so that, again, you return to basic function, but there's still something maybe a little bit there. I want to now shift gears to talk to you about my experiences with probiotics and irritable bowel syndrome. In 1998, after sharing the frustration with my IBS patients about my ability to not really do for them as much as I wanted to help them feel better and improve their symptoms and control, improve their quality of life, I went to a nutritional conference and was introduced to the concept of dysbiosis and probiotics. And by probiotic, by definition, I'm referring to a bacteria that has been shown to have a health benefit, introducing it into the body. Dysbiosis is a condition of an imbalance of gut bacteria that has been, in some cases, associated with some people with irritable bowel syndrome. And this imbalanced gut bacterial picture, not enough good healthy bacteria, promoting bacterial overgrowth of the bad bacteria or pathogenic or unhealthy bacteria, this imbalance can be created. And after doing some of my own homework and research and reading literature sources dating back to the 1960s, I found some articles that suggested that the use of probiotics in IBS patients had a positive effect by improving some of the most common symptoms, and that some of the IBS patients were actually deficient in the good bacteria that was supposed to be living in the colon under normal, healthy conditions. And it was at that time that I began using probiotics in my practice, and although I was doubtful and understood what role the placebo effect played in any IBS patients, what I mean by that is if I have an IBS patient and I'm sitting in the office with them and I present them with a sugar pill and I tell them this is going to help your belly pain, almost 50% of people may actually take that medicine, that placebo medicine, and they're going to come back and say that it seemed to help them. So I was always concerned about the placebo effect with probiotics, but now 9 years later, looking at all the literature that's come out, and of course all the hundreds of patients I've treated with probiotics, I think there's a lot more than a placebo effect going on here. and that's being scientifically proven as we speak. So, what did the probiotics seem to do? They helped reduce abdominal pain. They helped improve bowel function. They helped reduce gas and bloating. And they helped rely less on the antispasmodic, so maybe you didn't have to take it before each meal. You can now take it once or twice a day or once a day. It was clear that a subset group of IBS patients were clearly benefiting from these probiotics. So patients with more mild to moderate IBS symptoms with less of a component of anxiety and depression and stress, more in the diarrhea or diarrhea alternating patients, diarrhea alternating with constipation patients, where the predominant bowel movement patterns were not necessarily the constipation, those people seem to benefit the most from probiotics. How do probiotics work? Well, these healthy bacteria have been shown to have many beneficial properties. They help reduce inflammation in the intestinal tract. They have a crowding out effect at the cellular level by maintaining their large presence. Probiotics can crowd out the bad bacteria and prevent them from getting absorbed through our GI tracts into our bloodstream. Probiotics have also been shown to secrete bactericidal substances that have been shown to inhibit the growth of bad bacteria, again suppressing the pathogenic or bad bacteria. They also aid in strengthening the immune system, which the majority of the immune system resides in the gut, GALT, the gut-associated lymphoid tissue. Probiotics make vitamins. Probiotics produce substances called short-chain fatty acids that have been shown to help prevent colon cancer or reduce the incidence of colon cancer. Probiotics help us to fight against the onslaught of gastrointestinal infections that we are so commonly exposed to almost whenever we go out to a restaurant and eat uncooked or spoiled foods. The severity of the infection and the duration of the illness from food poisoning is, in my opinion, closely associated with an optimal level of probiotics in the gut.